Fibromyalgia. If we break down the word, fibro meaning fiber or fibrous tissue, my meaning muscle, algia meaning pain. It is a chronic disorder, chronic diffuse pain syndrome, similar to what we call as chronic widespread pain. There is no inflammation present in the muscle, tendon, or the ligaments. Pain can be felt on all the four quadrants of the body, and also the pain is present on the specific tender points on the body. Sufferers usually define it as deep, diffuse muscle pain. They also complain of chronic fatigue, cold fingers, hands, dry mouth, feeling of anxiety and depression, etc. The negative impact on the quality of the life of the patient is very high, making the daily activities such as lifting objects, walking, and even going up or down the stairs very difficult for them, thus increasing their disability index and also the usage of healthcare services. Etiology and pathophysiology is still not understood and is unknown. But what we do know from the studies that have been conducted is the pain is muscular in origin, but there is no inflammation present in the muscles. Current theories suggest it is a disorder of pain regulation and central sensitization, which means central nervous system is hypersensitive to the pain stimuli, or it can be a belief of pain when actually it is not present. That is why it is a widespread pain. The pain is so intense that patients wean even at the thought of hugging their loved ones. Patients' immune system, external stress factors, anxiety, depression, etc., have shown to have an effect on this condition. Usually, fibromyalgia is seen in the female population compared to the male population, the ratio being 3 to 6 is to 1. The age is around 25 to 50 years, and the prevalence of fibromyalgia does increase with the age. The associated conditions that can be seen are low back pain, anxiety, depression, chronic fatigue syndrome, myofascial pain, rheumatoid arthritis, endometriosis, Lyme's disease, hypermobility syndrome, irritable bowel syndrome, obesity, etc. Fibromyalgia patients mostly come in with a complaint of feeling bad and fatigued. Often the patients relate their onset to a traumatic experience. They even remember the day, time when the condition started. The signs and symptoms include multi-site pain, aldonia, which means pain caused by stimulus which normally do not cause any pain, focal muscle tenderness on palpation, diffuse stiffness and aching present, which is usually in the morning. Dr. William Oslo, in his book Principle and Practice of Medicine, states sleep disturbance is a very huge problem. Patients do not feel well rested. They wake up in the morning feeling very groggy. The aching pain on the back of the neck is a constant complaint. They even have spots of local tenderness on their spine. Fatigue, tiredness is one of the major complaints. Cognitive disturbance, such as processing and acquiring knowledge, understanding and interpreting thoughts, experience, gets affected. They have fibromyalgia fog as well, which means there's reduced attention, reduced ability to concentrate, and even difficulty doing tasks. Diagnosis of fibromyalgia is usually very difficult and can take up to few years as there is no lab testing to confirm it. The patient usually comes with a history of widespread musculoskeletal pain on different points of their body for over 3 months. These points are called tender points and are located bilaterally on the occiput, lower cervical, trapezius, supraspinatus, second rib, lateral epicondyle, glutes, greater trochanter, and knee. The history also include fatigue and sleep disturbance. There can be other associated conditions such as irritable bowel syndrome, headache, or cognitive disturbance. On physical examination, focal point and widespread tenderness is present, but no joint swelling or inflammation. The lab findings for complete blood count, erythrocyte sedimentary rate, or C reactive protein are normal. According to the American College of Rheumatology, the diagnostic criteria for fibromyalgia are history of chronic widespread pain for over 3 months. There should be 11 to 18 tender points on palpation. The widespread pain index and the symptom severity scale should have score of more than 7 and 5 respectively. Differential diagnosis should be done and other condition should be ruled out for the diagnosis of fibromyalgia. Management of fibromyalgia can be done with different techniques. Cognitive behavioral technique being one of them, in which acceptance and commitment therapy, mindfulness to reduce stress, etc. can be used. Physical exercise based techniques are also highly used for the treatment purpose, such as hydrotherapy, manual therapy, myofascial release, etc. Hydrotherapy is the treatment of choice for this presentation. Hydrotherapy is therapeutic. The whole body, mind is calmed and relaxed. Hydrotherapy has many varieties of benefits. It reduces pain. The heat in the water helps relieve pain. It also increases the soft tissue extensibility, thus helping in increase of range of motion. The buoyancy reduces the direct pressure on the joints, thus reducing the associated pain and allowing more free movements. The water resistance helps to increase the muscle tone and also build the strength of the injured or deconditioned muscles. Types of hydrotherapy are water circuit therapy, aquatic exercise, aquatic massage, steam bath, and saunas. Physical exercises that can be done in hydrotherapy are water walking or jogging, cycling, push ups, balance exercise such as one leg balance, sidestepping, pool planks, arm raises, etc. can be performed. The role of physiotherapy in the management of fibromyalgia can be divided into physical outcomes and mental outcomes. In this slide, we will talk about physical outcome. The principle of hydrotherapy can be used to overcome many concerns. Warm water allows a unique environment for relief of pain. It is different from swimming as it utilizes special form of exercise to help controlled movement and muscle relaxation. It helps to work on muscle tone by loosening those tense, tight muscles, improve blood circulation, and provide overall relaxation. It also helps improve flexibility, thus improving the range of motion. Buoyancy and viscosity helps offloading of the joints and reduce pain. Resistance can be used to improve the strength. Balance can also be improved by using support, then progress by using drag to turbulence to destabilize. In the RCT undertaken by Dennis Evick et al. On the effectiveness of aquatic therapy in the treatment of fibromyalgia, there were two groups, the target group which performed aquatic therapy exercises and the control group which performed home-based exercises. It was observed that an average of reduction in the pain score was 40% in the target group, whereas only 21% in the control group. After 24 weeks of follow up, pain reduction was still significantly low in aquatic therapy group. This indicated that aquatic therapy has long-term effects in improving the long-term physical conditions of fibromyalgia patient. In addition, clinically significant gains were observed in the Fibromyalgia Impact Questionnaire and quality of life parameters up to 12 weeks in both the groups. However, the long term result up to 24 weeks showed a significant divergence in the aquatic therapy group in comparison to control group, indicating the long term benefits. The limitation to this study was it did not have double-blinded design, nor there was a placebo control group, thus increasing the risk of bias. In addition to physical conditions, anxiety and depression are two conditions which are commonly associated with fibromyalgia patients. These are also improved by hydrotherapy as presented in the systemic review by L. Parenton et al., where 10 out of 11 RCT reports anxiety and depression related outcomes improve immediately following intervention periods and after follow-up period. This finding indicates that although passive treatment in fibromyalgia in warm water can lead to improvement in fibromyalgia related outcomes, the exercise component is more important in changing depression related outcomes. Limitation to this review is that it only presents components of hydrotherapy programs that are effective and does not consider components of hydrotherapy programs that are ineffective. And the scope of the review is limited to randomized controlled trials published in last 10 years. The message above is consistent with the finding of systemic review by J. McWin on effectiveness of hydrotherapy in the management of fibromyalgia syndrome, where Beck depression inventory score was improved in the target group in comparison to control group after intervention, with improvement lasting an average of 6 months. The strength of the systemic review by J. McWin was that each article was scored independently by 3 reviewers, comparing their findings, and again a fourth reviewer was present to resolve disagreements, thus reducing the risk of bias. Limitation to this review was that it was difficult to make specific recommendation for clinical practice due to the heterogeneous nature of the interventions. In RCT, to understand the clinical effectiveness of deep water running to treat fibromyalgia by Marcos Rento, it was found that Fibromyalgia Impact Questionnaire depression score improved significantly after 8 and 15 weeks in the target group undertaking deep water running, and short form 36 health survey also showed significant improvements only in deep water running program and not in the control group undertaking the land based exercises. A strength of this study is it was blinded, therefore reducing the risk of biasness. Limitation to this study was it was only one form of aquatic exercise that was considered and the placebo control group was not present. Fibromyalgia is a chronic pain condition. It does not have any particular treatment method, therefore making it very difficult for the patient suffering from it. It is very important to know your patient, where they come from, what is their physical and mental status, so that physiotherapists can go in depth to understand how they feel to improve their condition. Physiotherapists cannot alleviate their pain completely but can mitigate their pain intensity, which in turn helps reduce their anxiety and depression. There are many ways to treat fibromyalgia, hydrotherapy being one of the best as it not only reduces the physical but also the mental conditions. Patient education, self management strategies for daily activity of living should be provided to help the patient. Physiotherapist and patient can work closely together as a team to combat this painful condition.